right. Let's pick up where we left off on Wednesday. If my screen will show anything. There we go. Okay, so on Wednesday, we talked about the different forms of feedback. Okay, feedback, there were two types, positive and negative. Which one is more common? Negative. Okay, and we called it negative feedback because we're going in the opposite direction of whatever the disturbance is. Like when we're shivering because we're cold, we're trying to heat our body back up when our body temperature is dropping. So temperature is dropping, it's going down, we bring it up. Okay, that's an opposite response. Okay, three components to feedback. You got your sensors or receptors that detect that initial change to the control condition. They provide the input to our control or integrating center, which is typically an area of our brain. Okay, the brain decides what to do with that information and elicits output, which is a signal that travels out to our effectors. Okay, effectors are typically muscles or glands that produce a response. In the case of childbirth, which is a positive feedback loop, it's an enhancement of those uterine wall contractions until the baby's born and the feedback loop is terminated. Let's talk just briefly here about feed forward, which is different from feedback. In feedback, we're having a response to a change in a controlled variable. So this happens and then we respond. Okay, much more common is feedback, but there are a few examples of feed forward, which is a anticipatory thing. So we're doing it before something's actually changed as far as a controlled variable. Okay, really about the only time we talk about it is the example that I've included here, and which takes place even before we start to eat, when we're hungry and we actually start digesting, even though we haven't even eaten anything. Okay, so consider this example. Suppose the nutrient concentration in your internal environment becomes too low, so like your blood sugar is low. Okay, this causes you to feel hungry. At this point, if you see, you smell, or even you think about food, a feed forward mechanism causes your mouth to start to salivate, so you're going to produce saliva. Your stomach starts to secrete gastric juice, which is a digestive juice, even though your stomach's empty. This is part of what we call the cephalic phase of digestion, and it prepares our digestive system for food that's about to be eaten. It's like stretching before a race, okay, getting your body ready for what's about to take place. Make it easier for the food to be digested and nutrients to enter the internal environment. We don't really talk much about feed forward in this class, but I wanted to present it to you at this point anyway. So last time we talked, we focused really on maintaining homeostasis or balance, as we like to use the term. It's a little simpler to remember, okay, which we said is difficult because we're always being bombarded. We're always having disruptions to homeostasis, but for the most part, our body is able to keep our body temperature in check, our blood pressure in check, heart rate in check, oxygen levels in check, et cetera, et cetera, et cetera. Okay. Fortunately, there are periods of time where we will have a homeostatic imbalance occur. Homeostatic imbalance is just when one or more components of the body loses the ability to help maintain homeostasis. But for the most part, as long as all of those body's control conditions remain within certain limits, like our body temperature doesn't get too high or too low, heart rate doesn't go too high or too low, blood pressure doesn't drop too far, et cetera, et cetera, et cetera, body cells are going to function efficiently and homeostasis is maintained. If that imbalance, though, is moderate, a disorder or disease may occur. Now, these terms a lot of times get used interchangeably. Truly, they're not technically the same thing. A disorder is just any abnormality of structure or function, whereas a disease is a more specific term for illness characterized by recognizable signs and symptoms. And the terms signs and symptoms get used interchangeably when truly they're not the same thing. Okay, we can describe signs as objective. Symptoms are subjective. Anybody know what I mean when I say objective versus subjective?
Depends on the person.
Depends on the person? What do you mean?
Like some people might have one symptom, but another person will have there's a range of symptoms.
It's a good guess, but not right. Not quite right, anyway. Go ahead. Nope, not quite. Okay, so the terms objective and subjective here refer to the ability to measure or not. Okay. Signs are objective, you can measure them. Heart rate, you take someone's pulse. Blood pressure, you put a BP cuff on them, put a pulse oximeter on their finger to measure their oxygen levels. Okay, those are things that can be measured and compared from one person to the next, right? A lot of that is what the nurse does right when you get into the exam room. Okay. They also ask you how you're feeling. Okay. Are you experiencing any pain today? Can you measure pain? You can try. There's a scale. How do you feel today on a scale of 1 to 10? What's one person's 5 compared to another person's 5? Can you measure nausea? No. Those are things that are different from person to person. That's what a symptom is. Okay. So headaches, that's a form of pain, are examples of symptoms. Fever or swelling is a sign example, or are signs examples. Now, swelling, sometimes when people kind of get a little tripped up on, you can actually measure swelling. Okay. Like if you have a swollen ankle, you can wrap a tape measure around it and then measure the other ankle and see what the difference is. It's not always perfect, but you can actually measure swelling. So those are moderate imbalances. Last thing here, obviously if we have a severe imbalance, it can result in death. But here's something that's going to be really weird for you to hear. I'm going to say it, and I'm not going to ask you to, try to prove me right or prove me wrong. The human body is so amazing, so great. Here's the weird sentence that I'm going to say. It's really hard to die. Really hard to kill somebody. You can be very extreme, and I mean, obviously, there are easy ways to kill somebody. Think about the fact that we've talked about this already now. Every day, all day, we're being bombarded with changes to our internal environment. And we experience extreme conditions here in Kansas, temperature-wise. Okay. But our body is able to survive for the most part without too much trouble. Okay. We're amazing creatures. We're able to resist change. And that's why people can live. Modern medicine helps, obviously, very much so for several years. Okay. So don't try to prove me wrong. Take me for what I say. Now, I was just talking about modern medicine. And I know we talked about going through roll the other day. A lot of you guys want to be something in a medical profession. A lot of you said you wanted to be a nurse someday. You guys are going to be a big component of performing diagnoses. The science and skill of distinguishing one disorder or disease from another. Anybody like to watch the show House? Okay, that's an actual show about diagnosing illnesses and figuring out what's wrong with people. Really, especially in the early seasons, really focuses on the science, less so than like Grey's Anatomy and those other shows that are more the drama outside of the hospital. Okay. But that's what diagnosis is, trying to figure out what's wrong with somebody. Okay. A lot of things go into helping perform a diagnosis. Okay. Symptoms and signs, we just talked about those. Medical history, which is a collection of information about the events that might be related to that patient's illness, which includes a chief complaint. So why are they going to the doctor in the first place? Sometimes it's very obvious. Okay. Sometimes it, is not so obvious. History of present illness, how long have you had it? Past medical problems, has this ever happened before? Family medical problems, those play a big role a lot of times. Social history, review of symptoms, so on and so forth. Okay. And then lab tests. And physical exams, a lot of nurses are responsible for this and other people in the hospital as well. Physical exam is an orderly evaluation of the body and its functions. It involves non-invasive techniques of inspection, which is like just looking at the inside of your nose and, you know, using that scope to look in your ears, look at your throat. Okay. Palpation. Anybody know what palpation is? Not palpitation, but palpation. This is where like the doctor or nurse will touch you. Okay. Poking around. Okay. When you're sick, a lot of times they rub on your neck, right? They're not doing that because they're giving you a massage. Okay? They're doing that because they're feeling for things. Okay. Auscultation. You know what that is? Listening. Okay. Stethoscope. Take a deep breath in. Okay. And then percussion. Percussion in a band is the drummer, right? Okay. Well, there's ways to tap on the body and see what happens, like when you have that knee-jerk reflex tested. Okay. Along with the physical exam are measurements of vital signs, so like taking blood pressure and your pulse and that kind of stuff. And then lab tests, you know, might be a blood draw, might be a urine test, etc. All right, to kind of wrap us up here with our first lecture, just kind of to reiterate some of the most important themes that we're going to talk about throughout this course. Some of them we've talked about already. Some of them we will throughout the entirety of the course. First one there we've talked at great lengths, and that was the title of the entire lecture. Homeostasis, once again, is maintenance of relatively stable condition in our body's internal environment. Because it's vital to normal functioning of our body, it's the most important theme in this class. Integration is another theme that we actually defined earlier in the lecture. Several components work together to accomplish a particular function. We had that picture where there was all those boxes of the organ systems with lines drawn from one to the other, demonstrating how they all work together, like players on a football team. A mechanism of action. First, explaining how the body works by indicating mechanisms involved, because it is the way the body functions, or it's the way we explain it from a theme. And then communication. Cells of the body must communicate with one another in order for the body to function.